Hello everyone, welcome to sqadia.com. Today the topic of our lecture is deliberate self-harm, which is also abbreviated as DSH. Now, basically when we define this condition, it's basically the intentional injuries which are caused by the person himself or herself. Now, there are a lot of reasons which can correlate to this deliberate self-harm, ranging from the emotional instabilities, emotional liabilities a person is suffering from, personality disorders, or even the environmental conditions can contribute towards this kind of a deliberate self-harm. So this is the topic of our lecture today. The sections basically comprise of, firstly and primarily, we'll be discussing the self-mutilation. Self-mutilation basically means the harming of one's body, which doesn't prove to be fatal, and that is basically defined as the self-mutilation. We'll be discussing its causes that are related to it, and then we'll be moving on to the differential diagnosis of self-mutilation. In the second section, we'll be describing the suicidal attempts, specifically the risk factors that are related to the suicidal intensive attempts that may be successful or that may not end up successfully. But still, the clinical presentations will be discussed over here in this section. Along with that, the fatal presentations will be discussed. Basically, it's not always a successful suicidal attempt. So we'll be discussing the factors which can result in the fatalities and which do not end up or which do not prove to be fatal in a lot of cases. In the very third section, we'll be discussing the self-harm assessment. So once you have a patient at your hand, you should know how to manage such a psychiatric patient. And dealing with psychiatric patients, obviously, you'll have to basically assess the severity of the disease in that particular patient. So the factors to consider while you're assessing a particular patient, and then the assessment of the risk factors as well, just to get a better understanding of the level of the disease and how are you going to inculcate the different treatment modalities. It's again very important over here. The general aim while we're assessing the patients, why do we do it, what's the purpose of assessing the patients, that will be discussed over here in this very third section. In the fourth section, subsequently, we'll be discussing the self-harm behavior. So some people are basically prone to this deliberate self-harm, and we'll be discussing what kind of a personality trait basically makes you prone to this self-harming behavior. Then the interviewing is very important, and we'll be documenting the important points that are basically leading towards that self-harm behavior. And along with that, we'll be discussing the investigations and the outcomes. The prognosis again is very important. There are a lot of treatment modalities out there, but what is the prognosis in a particular patient, and how is the prognosis dealt on, or it is basically leading towards that particular outcome according to the risk factors. Then in the fifth section, in the final section, we'll be discussing the management of self-harm along with it. So the short-term management is important, and then we'll be dealing with the long-term management along with it. The research and prevention is done in details over here. There are a lot of researches going on to prove this deliberate self-harm, that it's basically a very important pathological condition of the psychiatric origin over here. And how do we prevent this condition? It's going to be discussed in the last section. So I hope you want to learn more about this deliberate self-harm. So do watch the other sections to this lecture as well.